I'm going to ask you a few questions, sir.
Mhm.
And firstly, Dr. Saxena, I wanted to start with asking you, what do you think is the reason behind the rise in suicides at top institutes in India?
Well, uh, it's not very different from any other parts of the world, although not all parts of the world, but young age suicides have been increasing almost all over the world. And later, schoolgoers as well as college goers are also very prone for suicide. The numbers are definitely increasing. One cannot really pinpoint one reason for this, but there are a variety of reasons, and also those reasons which are more applicable for India. One is an excessive amount of pressures in terms of competitions to get into the school or colleges that they would like to, and also within the schools and colleges to perform better. Uh, there is a there is a very clear relationship between the pressures that we are subjected to and our own feelings, anxiety as well as mainly anxiety and apprehensions, but also on our performance. So if you draw a chart, and I know that you're an engineering student, you know much more about charts than I do. But if you draw a chart between performance on the vertical axis and anxiety on the no, sorry, the other way around. The performance on the vertical axis and anxiety on the horizontal axis. It's the U-shaped graph. So for certain levels of anxiety, increasing anxiety give rise to better performance. But after a point, it decreases, and it decreases quite steeply at the top end of the graph. So essentially, if you keep increasing the pressure, then up to a point, it the performance and the effect level, the emotional level, it keeps improving. If we didn't have any pressures, perhaps we will not work at all. But after a point, it comes down, and I think very many students nowadays, in fact, it applies to most of us also, are on the other side of the graph. That means the performance goes down. And if the performance goes down and the pressures continue, then it becomes a vicious cycle that you're not able to perform as well as you could. And the pressures keep increasing because your performance is low, so the pressures continue even higher. And that gives rise to excessive anxiety and then depression. And that is one of the reasons why it is happening. So, overall, I think to some extent, decreasing the amount of pressures that we are in will certainly help. So, that's one. The second reason is increasing people being unsupported. There were traditional mechanisms of support that we all enjoyed. It was part of the family, it was part of the community. We stayed where we were and where our families were. And increasingly, we are living apart. So people might be in the hostels, people might be living in a different city, and the traditional ways of being supported in terms of family, community, even religious leaders,
Mm,
and the larger family, of course, have
mm,
come down. One, they are not there near you, and the second, that distances have also increased, even if you are near them. So
mm,
the communication has decreased, and the understanding of
mm,
uh, of a different generation has decreased.
mm,
Of course, you could say that there are a lot of people who are in touch with their peers and the friendships and even social media, but the quality of that support is not the same as the
yeah.
traditional ways of support.
Yeah.
And in some cases, people that you know are actually increasing the pressures rather than to provide support.
Yeah.
So that is the second reason, changing and decreasing informal social and family support. The, the third reason could actually be the kind of larger environment that we are living in, which
Mm-hmm.
includes structural elements which give rise to uh, increasingly people being on their own rather than
Mm.
part of a group.
Yeah.
So you're supposed to look for a job yourself. You are up against other barriers. It could be
Mm.
reservations, it could be caste, it could be economic hardships, it could be
Mm.
excessive amount of money to be paid as bribes. It could be rules and regulations which come against you. It could be
Mm.
changing rules and regulations. Suddenly, in the
Mm.
middle of the term, you
Mm.
discover that the system has changed.
Mm.
Suddenly, you discover that you appeared in a competitive examination, but the results cannot be announced because of a court case.
Mm.
You discover that you have to appear again. You discover that you cannot anymore get admission in a state other than yours.
Mm.
So all of these things are actually structural barriers
Mm.
which increase the pressures on people, and those may be responsible. These are just some of those, but I'm sure there are other things happening which can give rise to. But I should go forward and go beyond the question that you asked. Uh, there are uh, there are things that the person can do himself or herself,
Yeah. Yeah.
but also there are things that can be done within the environment, close home, but also remote.
Mm-hmm.
So institutions have a responsibility, community of
Yeah.
course has a responsibility, and the people themselves have a
Yeah.
responsibility to do things.
Yeah.
And since you're asking the question as
That's
an
the next question.
organization, I should say
Yeah.
that you should divide the whole list of solutions into two parts: things that
Mm.
need to be done and
Yeah.
things that you could do. And there is
Yeah.
a big difference between them. You can't change
Yeah.
laws and rules, you can't
Yeah.
change the way colleges are organized,
Yeah.
but you can do a few things, and that's what you should focus on.
Mm. Right. And so, what are some of those things that, as an individual, a person could do to support themselves better? I think the next is, what are some of these things that the administration or the institution could do, right? What are some of the things that, as parents, we could do probably better, right? So, I probably, maybe we could delve a little bit into all of these. That will be helpful as well.
Yeah, let me divide the answer into four kinds of things that need to be done by four different kinds of stakeholders. The one is
Right.
the larger governmental responsibility,
Yeah.
which could be national, which could be
Yeah.
state, it could be even district,
Yeah.
and those are things that need to be done, which begins by making a national suicide prevention policy or strategy, implementing it in all the kind of jurisdictions that you have, and putting it as a national issue rather
Mm.
than a personal issue, because uh,
Yeah.
laws and rules and policies have a lot to do with why people go into these kind of behaviors. But that aside, because I think you can advocate for it, but you cannot do anything much more about that.
Mm.
Then the second stakeholder is the institutions, the, the colleges, the schools, the educational authorities, which certainly have a lot of role because they can make their internal environment
Yeah.
more mentally healthy friendly.
Mm.
There are some documents on, especially also one by WHO, on making schools mentally healthy.
Yeah.
What can you do within schools
Yeah. Yeah.
to make them a better place? And similarly for colleges, there is a lot of literature now to say how what can school administrations and college administrations do to make things better, which is to avoid all kinds of discriminations, to provide support as it is necessary, and so on. The third is the family and the community, which again has to realize that these issues are very major and imminent, and they have a responsibility to look after their family member. And increased communication is certainly one big part of it. Nowadays, the communication uh, is less, although we
Mm.
might be talking more, but our actual communication is less. And also communication about one's own emotions and
Yep.
the struggles that one is having has
Mm.
become less.
Yeah.
And so increasing that, keeping a tab on what's happening, knowing where the stresses are becoming overwhelming, the kind of coping mechanism that the person is going for, which could be use of alcohol, drugs,
Mm.
which could be the use of other maladaptive methods of coping, which might include even spending excessive time on social media or gaming. Those are issues
Yep.
that one has to, as a family, has to cope up with. And also then, as I was saying earlier, not putting excessive pressure.
Mm.
So it is important for a young person to do well in the university, but there are capacities that need to be recognized. Everybody can't be a topper, and
Yep.
everybody cannot get the best of the jobs.
Yeah.
So to actually be more realistic and to see to it that the pressures are not excessive is quite important.
Mm.
So those are things that community can do, and to be available, to be providing help whenever needed. And finally, what the person can do, which is to keep their own stress and anxiety level under a constant watch.
Mm.
We measure our steps that we take every
Yeah.
day, but we do not measure the amount of stresses that we are facing.
Mm.
We keep in mind the use of time by
Yeah.
every hour and by every minute, but we really don't think about what is the productive time versus the
Mm.
time that we are spending either ruminating or in maladaptive things like social media and other things. Of course,
Mm.
I'm not saying social media is all harmful.
Mm.
It
Yeah.
can, of
Yeah.
course, be very helpful also, but we
Excessive.
don't really think more about that. And then the coping mechanisms and the resilience that one can build.
How do we
And
measure our own anxiety? I think you
well,
brought in
there are
that point too.
many apps actually which do it
Mm.
for you, which is to answer a few simple questions. But even informally, one can just stop working and think for half a minute about how one was feeling as one was working.
Yeah.
And that gives a fairly good measure of how anxious or stressed we are.
Mm.
We can keep on our phones or in our diary a simple chart of how stressed we are at that point of time between 0 and 10,
Mm.
and one can very easily track that we are at
Yeah.
level 2 or at level 8, and then even go on to say what give rise to anxiety.
Yeah.
Is it the anxiety of attending classes, for example, or the anxiety of an exam, or anxiety of meeting friends, or whatever else comes in? So one can really very easily track that, not only how much anxious one is, but what are the reasons for that
Yeah.
anxiety. And then coping mechanisms and the resilience. And that, of course, is very personal. Some people will find meditation or relaxing or listening to music or reading a book that can be more relaxing than just studying all the time.
Yeah.
And one has to find out what works best, or talking to a friend or talking to a family member. But I think one of the good methods of keeping one's stress under control is to take out an hour or two every day for things that are not absolutely required but which are enjoyable. It could
Yeah.
be taking a walk, it could be listening to music, it could be doing exercise, it could be eating something that you like or talking to somebody that you like. And at that time, one has to dissociate completely from
Mm.
one's responsibilities of either studies or a job or whatever else one is supposed to do. And I think increasingly the young people are finding very difficult to dissociate.
Yeah.
And that is really the key. So these are the four stakeholders and the four kind of things that can be done. I'm still on what can and should be done and not on
Yeah.
what you can do, which is much
Yeah.
more limited.
Yeah. Yeah. So, if I may also ask you, where you talked about administration, right? You said there is uh, a lot of literature out there, a lot of material out there, which is there. Would you want to highlight a little bit of that? Like what institutions could do? Are there certain best practices that they should follow? Are there certain guidelines that have been laid out, which you could spell out? Because I know a lot of administration, we ourselves work with 150 plus educational institutions. I don't think a lot of them know how to, like, what are the best practices, right? Where should they look out for help? What could they as an institution should do? Would you want to throw some light on that?
Yeah, uh, one is making the the educational part, and I'm talking about now educational institutions,
Yeah.
much more predictable and transparent.
Hmm.
The student should know what they are going for,
Yeah.
what are the rules of the game, what are
Hmm.
they expected to do, and what are the things that they are expected not to do.
Hmm.
So that the rules of the game are very clearly laid out and they're not
Hmm.
changing from day to day or week to week because
Hmm.
unpredictability leads to distress, including the ways examinations are conducted, the ways assessments are done, the ways teaching is done. It should be very, very clear and completely transparent. For example, is attendance necessary or not? If you don't attend, is there a penalty to it?
Hmm.
And whatever other rules are there. So one is that being very clear and transparent
Right
about
at the
things to
beginning.
be done. Yeah, that is I think very necessary. And increasingly there is lack of transparency.
Hmm.
The rule says one thing, but your friend tells you something totally different.
Hmm.
So that should be, I think, one part of that. Second is to train the administrator and teachers to be aware about this stress paradigm so
Hmm.
that they are aware about what's happening in the class and also being very sensitive to the differing needs of different students, their
Hmm.
capacity to learn, their capacity to perform, and be on the lookout for people who may not be coping up well.
Hmm.
And that is very necessary for the for all the staff. In addition, there could be staff who are further trained to be counselors,
Hmm.
and or you can appoint, of course, counselors and psychologists to look after problems that are more than the usual,
Hmm.
and the access should be very easy.
Hmm.
People should not be stigmatized for taking help. Although I must say that young people are now taking much more help than earlier. In our
Yeah.
generation, it was a complete no-no, but now people are much more
People are opening.
keen to take help, which could be in person or it could be even remote and virtual.
Hmm.
It could be with a person or it could be with an app. But in whatever way, the help seeking should be encouraged and made accessible. So that's the third thing which institutions can do. And the fourth is if the problems arise, for example, there is a self-harm or suicide in the institution, then some further actions need to be taken. in such a way that those activities are uh, neither put as an example, a bad or a good one, and both are bad, uh, but but also that the community comes together
Mm.
to actually resolve the issue rather than to
Yeah.
keep it completely unspoken
Mm.
and uncared for.
Yeah.
Suppose in a class of 30 students, a student actually dies because of suicide, which happens.
Yeah.
What is the class supposed to do? The institution has a responsibility to actually resolve the issue,
Mm.
to have a community meeting, to think about what they could have done more.
Yeah.
Were there signals that they should have
Mm.
responded to?
Mm.
Was there help available which could have been provided?
Mm.
And to provide support to other students
Mm.
so that they don't take it as an example and repeat the action,
Mm.
rather to think about what could have been done and what they could do to resolve it. These there are clear instructions on how some of these things could be run, and
Yeah.
those should be done. The
Mm.
usual practice nowadays is to just brush it under the carpet and forget
Yeah.
about it.
Mm.
And that is not very helpful
Mm.
because everybody is thinking about it and
Yeah.
nobody is
The
saying anything
closure
about it.
doesn't come.
Yeah,
Yeah. The closure
closure
doesn't
has to
come.
happen.
Yeah.
And there are various ways in which could be done, but the institution has a responsibility to do that. Maybe discuss in a class, to have discuss in an assembly, to have a newsletter which analyzes it, to invite some friends to speak about it, to invite the family to visit and talk and so on. But there has to be something which needs to
Mm.
be there. So these are some of the things that could be done. But overall, a general sensitivity towards such issues is absolutely necessary as a part of the institution.
Mm. I like the way so you said general sensitivity, training of administrators, and they need to be aware about the stress parameters because more and more we speak to the institutions. I think they find it very hard saying not every administrator, not every teacher, staff even wants to get sensitized, right? That's not part of my job. So why should I be doing additional work? I think that's something that we constantly keep hearing, and as those institutes are becoming even larger, the number of people is going up, and I think it's very hard for five mental health professionals, 10 mental health professionals, or any app also that people reach out to them, right? If the community is not sensitive enough, not everybody who needs support is also able to reach out. So I think you beautifully described how do you meet. I think that taking that responsibility, a collective responsibility of the institution also has a big role to play. I also love the way you said, right, as family members, even though we have increased communication, but we are not communicating about our emotions. That is just going down and down, right? Maybe we are spending more time, but we are not talking what we are feeling. So, are there so you did talk about what needs to be done, right? You also talked about what as an individual I could do, right? I also wanted to ask you, sir, what as companies like ours who are into, providing mental health support to organizations, institutions, what more we could do to support the community better? What do you
I think there are several things which your organization could do. One is, of course, to advocate for more sensitivity to the subject by
think?
writing, by disseminating information, by going and talking about it in schools and colleges, and even to policymakers about that. So
Mm,
that is the part of awareness and advocacy that you can do.
mm,
But then you could make and publish supporting material and guidelines,
mm,
which you could make it available to everybody rather than to
mm.
only your clients,
Yeah.
so that you increase the availability of evidence-based actions.
Mm,
You
mm,
could publish a document on what should colleges do to respond to increasing number of suicides among the students.
mm,
What can a school do?
mm,
And have some resource material that is there,
mm,
and also some links.
Yeah.
and so that people can just pick it up,
Right.
and you disseminate it to 100 people, maybe 10 will do it, but that
Mm.
itself is good.
Mm.
And then you could have uh, some some tailor-made training programs. So
Mm.
once the school or college has taken up that material and become more sensitive, then you can offer actual training program, which can be delivered
Mm.
virtually also. To say,
Mm.
designate 5 teachers from your school who could take this 1 week program
Mm.
and get much better trained in responding to some of these problems. And that can be
Mm.
by registration, by payment, by or just voluntary. And then you can train them much more on that, and you can have some counselors and psychologists deliver that kind of program, which can even
Mm.
be recorded. It can be virtual. It
Right.
can be
Yeah.
a self-learning program that
Mm.
can be asynchronous. So
Mm.
some all those methods can be tried,
Mm.
and so you can increase the capacity of the institutions to respond. That's on the institution side. On the individual side, you're already doing quite a bit, as I understand, but you can increase that to be able to provide institutions with which are at the highest risk, to provide resources that are completely free,
Right.
to increase the awareness of students to take help from your resources, and and even provide incentives for doing that. So those are the things that you could do, and all of these things can actually be done, of course, with some preparations and some work. But nowadays, you could do that with an enormous amount of benefit, because once you make those training programs or resources, that can be disseminated very widely. India
Mm.
has so many schools and colleges, so I'm sure your your clients are in hundreds, but they can be in tens of thousands.
Yeah, tens of thousands
So that
institutes.
is the increase that you need. So yes, a lot can be done actually.
Then I also wanted, given that you look at global mental health programs and policies, I also wanted to understand from you: are there certain models that India as a country can learn from on how they have succeeded in reducing suicide? Something, or some institute has done a great job. Are there certain models we could learn from?
Yes, there are many case studies that have been done, and even articles written on the kind of research that has proven to be useful. One of them is peer support, how
Hmm.
people can support each other, because we talked about the teachers and counselors, but young
Yeah.
people sometimes prefer to take help from their peers rather than
Yes.
from other people.
Yeah. Yeah.
And peer support programs have been
Mm.
found to be extremely useful.
Mm.
And of course, you need to train some people to take a leadership role in that, and then establish small groups within the school or colleges who are willing to provide that kind of help, and those are very useful. I'm sure you can find them online, but I can search and provide some examples for you for the peer support kind of program, which I feel are for the small amount of resources that it will need. It's a very good method of providing that kind of support. Uh, some training, some leadership training will be necessary, but overall they then thrive on themselves. So you
Yeah.
don't need to actually provide continuing support.
Mhm. Wonderful. And I think I have some understanding, sir. I also probably, you did touch upon that, but I still want to ask you one more question. So, every institute that we see also have like student gymkhana or student wellness coordinators or some student body, so to say, right? Like you mentioned, these are the things that an educational institution could do better as administrators. These are certain things as a parent we could do better. These are some things as an individual I could do better. These are some things that as an organization like yours could do better. what are some things that you think the student body could do better to support each other?
Yep, a lot of things can be done by the student bodies. One, of course, is as we were talking about, to
Peer
start
support.
a peer support program.
Mm-hmm.
The second is to disseminate some of the awareness and advocacy material amongst the students. So, you see, currently everybody wants to hide the fact that so many people are under stress and are resorting to suicidal behavior. Uh, Institutions want to hide it because it gives them a bad name. Teachers want to not do anything about it because they are too busy with their educational objectives. And students also are not really paying a lot of attention on that. So the students' bodies can themselves actually become more sensitive and aware and be willing to provide that kind of help. I know
Mm-hmm.
of many examples where the friends of a student who actually died because of suicide formed a group which
Mm-hmm.
then assist other students. So those are the things that can be certainly done. And then student body can also approach the administrators to with the demand for more access to care that can be done. Right now, that doesn't happen because people don't want to talk about it. But if they become more sensitive, they should ask for psychologists or counselors' help, and the school and college will be forced to pay more attention to that because that is what they respond to. They have a responsibility towards students, and if they want something, then it will become quite important for them to provide it. So, in a variety of ways, they can help. And in fact, some of your resources could be to the student bodies as to how they can take this issue forward.
Mm-hmm. Yeah, probably because I think they feel the most for the students, and they sort of, and
Yep,
they're also there with each other as peers, right? Maybe staying
yep,
in the same floor, same, sometimes same room as well,
yep.
right? Yeah. All right. Yeah, thank you so much, sir. I think I have a lot of support and a lot of things to reflect on, a lot of things to learn about. I think I personally learned a lot from you. Is there anything you think that that should be added, which would help more? Should I ask more about the Live Life report, which is a WHO guideline, or anything you think that should be added further to this,
I
which
think
should help
WHO
people?
has a lot of resources, and you are aware about it seems about all of them. So use them, but modify them for the Indian conditions. So
Hmm.
I think it will be nice for you to review them and do that. And yeah, if there is anything I can help with, feel free to come back. And
Right. Maybe last
you did
question. I
talk
would.
about some event in February. Do you already have
Yes.
the dates?
So 8th of February, 2025.
Can you send me a kind of calendar invite, which I
I
can
will.
then put in my calendar so that
I
it's
will.
there? I'm not sure whether that will be possible for me to travel to India for, but I just want to keep that there.
Absolutely. Absolutely. So maybe I'll ask you one last question because I hear a lot of administrators also talking about it. Do you think some sort of screening, some sort of assessment on mental health status should be done maybe while the students are on the campus so that if there are people which have high vulnerability, maybe they need to be looked after more? Is there something that other countries are doing? Is there something that we should do? Because a lot of our institutions have very high population as well, 10,000, 20,000, 50,000 people studying.
Well, uh, it's controversial whether those things really help. On a voluntary basis, yes, but on a compulsory basis, I would not suggest that actually.
Mm,
So, uh, for example, when students get admitted to a college, as a part of their welcome package, there should be a leaflet or a document electronically which goes and says, we do understand that the college environment can be stressful.
mm,
We would like you to take this questionnaire
mm,
and anonymously submit it.
Hmm.
I would say anonymously because people are very reluctant to put their
Yeah.
name on that.
Yeah. Yeah.
And so that could be part of the screening so that the administrators will know whether 5% or 10% people are at a high risk, but they will
Hmm.
not know who's at a high risk.
Yeah.
So there could be a kind of ongoing monitoring about that.
Hmm.
And then, of course, there should be a method of course, all colleges have a student welfare center or a counselor, so that address and other details or email should be given there to say
Yeah.
if you do feel that you need help, then here is
Reach out.
where to go.
Yeah.
So compulsory, no. By name, no. But as a voluntary basis and anonymously, yes.
Got it. Got it. Because that's a question a lot of institutions keep asking. Should we do it, right? Like some of the recent suicides, they came to know that the person was under psychiatric medication for 3, 4 years, but nobody knew about it.
Mm,
So no
mm.
extra care could be provided. Okay. And the person didn't disclose, the family didn't disclose, and they didn't know what, like, it's all post-mortem that we are coming to know about these things. So
Yeah.
there's always this question that is there a way while they are coming in, we find out these information so that we could like keep reaching out to such people and just checking on them.
You see, with so much stigma against mental health,
Yeah,
it doesn't work if you make it compulsory. You can't
correct.
force people to do that. You can
Yes,
just increase the access to
yes,
information and care, and you could make it uh, a normal part of a college life.
right,
That people are like people say that my eyesight is not good, or I need specs, or I need this adaptation.
right.
uh, Similarly, people say I need some help here,
Yeah.
but you can't force people to disclose and you can't force people to take help.
Yeah. I like the example that you gave, right? If we make it mainstream, like how people go to a gym and run because not because they have malaria, diarrhea, cancer, they go there to be better.
Yeah,
Similarly, can start people start taking care of their well-being, right? Like they gave an example of specs. I think I remember almost everybody in my class is wearing specs, and that was common. It's okay. Somebody will say, "I would take a laser surgery. I will do this." That's, but people would talk about it, right?
yeah.
Whereas mental health challenges, issues, what they are feeling is not what I think. As a community, we have made it safe for people to talk about. It's always, I think, a lot more advocacy, a lot more sensitization around that has to be done. Thank you so much, Dr. Shekhar. I think so
Okay,
much to learn from you. Thank you for your time.
not at all. Good luck with all the things and keep me informed.
Yes, I would. And I would block your calendar for 8th of February 2025. Thank you so much,
Okay,
sir. Thank you for your
righto.
time.
Bye
Take
bye.
care. Bye bye.